I'm pleased to announce the session 4, which is called InnovateHER, a session after my own heart, inspiring women entrepreneurs in healthcare. This is a panel discussion. Here, I would like to quote some excerpts from the story by Sudha Murthy. India lacks participation of women in the workforce in general. Since the input is less into the system, we also see fewer women going up the ladder. This session is not about comparing the women versus the men, but it is a constructive effort to bring insights from women leaders in providing social proof role models for the younger generation. What are everyday challenges and insights in overcoming them? What are the systematic changes that we gather from the thought leaders to enable the women's leadership across sectors? I'm pleased to invite Ambassador Katrin Kivi, Embassy of Estonia to India, on stage. Thank you. Ma'am, please. Further, I would like to invite Shriya Sethi, Director, International Innovation Corps. Please put your hand together to welcome Upasana Arora, Director, Yashoda Super Speciality Hospitals. Dr. Debleena Bhattacharya, Assistant Professor, MEFGI. Preeti Rao, Founder and CEO, Weljii. Priya Prakash, Founder and CEO, HealthSetGo. And last but not least, Veena Sehgal, Service Provider, Cadence Hub. Thank you. Now I would like to invite Ambassador Katrin Kivi to come and do her keynote presentation. Thank you.
Thank you very much. Honored delegates and guests, ladies and gentlemen, thank you very much for these warm welcoming words. It's my pleasure to address in front of such a distinguished audience today. Today's panel primarily aims at encouraging women to take leadership in or at least work towards achieving a more balanced participation of women and men in the healthcare sector. I do not come from the health sector myself. I'm a diplomat, but I'm personally convinced that gender equality must become a basic norm in any sector of public life. In professional life, no matter whether you are men or women, what matters is that you go for what you believe in and that you do what you do with enthusiasm and determination, with passion. Ladies and gentlemen, I'm today here trying to set a personal example. In my embassy in New Delhi, we are 80% women. All three diplomats, myself, my deputy, my consul, are women, but also all three secretaries in a visa section, in consular section, yes, visa section, administration and secretariat. We are all women. The president of Estonia is a lady, and many Estonian ambassadors in the recent years have been ladies as well. Only to name few of them, ambassadors to United States, Russia, France, Germany, United Nations, Australia, European Union, NATO. But of course, I'm considering the posting in Delhi also as a crucial one, so I'm happy that my country has given me that opportunity. And this is, of course, not because we are women, but that this is, of course, the expertise, creativity, professionalism. And everyone should be equal and have equal opportunities. But quite often, to tell the truth, you know, women have made their professional life, those women who have made their professional life up to the very top level have been working much harder to get the job, or they were forced to make much more sacrifices in their personal lives in order not to break their successful careers. And sometimes, in similar positions, women earn less than men, and that's not fair too. Important elements are also the norms, values, and attitudes that prevail in the society. But gender equality as such, or in particular, could be seen as the quality mark of a well-functioning democracy. No one should be confronted with gender-based stereotypes, unequal access to education, justice, or labor force. As of India, I just recently met Mr. Amitabh Kant, who is the CEO of National Institute for Transforming India, and he told me that currently only 28% of working-age women were in the labor force. So there is something to do about it, and he is eager to deliver on it. And I heard that you are working also together closely with his team. So paying more consideration to the fact that inequality does exist, we must be able together to reverse that trend. And government's role is critical in finding out the responsibility in the reasons of inequalities, and also as much as set an example. Addressing the root causes of gender equality and inequality must apply to all policy areas. I'm proud that in Estonia since 2004, we guaranteed to parents sound financial security after a child is born. And the parental benefit system is encouraging both parents to share the childcare responsibilities and enables all interested women to return to labor market quite flexibly. Ladies and gentlemen, changing outdated stereotypes must start from very early, from the beginning, and education is there very important. Every child in Estonia has equal access to the education, which is rated one of the best in the world. But to promote tech education in my country, we have even introduced several initiatives such as Tech Sisters among girls. And next Friday, I will be participating in India Good Girls Take Over initiative, organized in the framework of the International Day of the Child Girl, or Girl Child. And I will share my power and stand up for the rights of the girls, like my embassy did it already last year. Distinguished audience, ladies and gentlemen, there is an enormous potential in engaging women equally and fully in India. And only a few days ago, I was so happy to read about what Prime Minister Modi said about it. And he's also trying to do more for girls and young sisters of this country, of the country of Mahatma Gandhi. And I've heard about Plan India too. I'm particularly happy now by finishing my short address that I could hand over the micro also to ladies. And they have to deliver some meaningful messages to all of you. So it looks like at the Estonian embassy, it's called Women Power. Thank you so much.
Thank you, Ambassador Katrin. I would now ask Shriya Sethi, Director, International Innovation Corps, to moderate the panel discussion on InnovateHER.
Hello. Thank you, Ambassador. That was a lovely keynote, and I think it sets the context for this conversation very well. I'm Shriya Sethi. I'm the director at the University of Chicago Trust's International Innovation Corps, which is a young professionals fellowship that works in the social impact sector. When Sachin asked me to moderate this panel, I thought it was very interesting because it brings two topics very close to my heart: women entrepreneurs and healthcare. And I have the task of trying to make sure that we can talk about both in the next hour or so. So I want to just start off by giving a few facts on women entrepreneurship and healthcare in India. which I'm not sure if everybody in the room, by the way, I'm really impressed to see the number of women in this room, and it's great that at a healthcare conference we see more than 50% representation of women in the room, so that's great. So like the ambassador mentioned, women's labor force participation has actually fallen from 35% in 2002 to 24% in 2012. 1 out of every 4 financially excluded women in the world is actually in India. Less than 14% of all entrepreneurs in India are women. The index of women's entrepreneurship ranks India 52 out of a list of 57 countries in the world. These are all pretty depressing highlights, right? Moving on to healthcare. Doctor-patient ratio in India is 1 out of every, doctor-patient ratio is 1:11,000, where WHO standards prescribe 1:1,000 doctors. India is ranked 145 among 195 countries in terms of healthcare access and quality. And the Landslide report reported that 2.5 million Indians died due to treatable diseases. So it's amazing that considering how few women entrepreneurs we have and the state of healthcare in India, we managed to get across 5 amazing women in the space of healthcare to talk about their journeys and how they have actually made an impact in the space of healthcare through their passion. So I'd like to start this by just asking each of them to introduce themselves, keeping in mind the question, why is it you do what you do? So if we could just go around and have maybe 2 to 3 minutes introduction of, so we have a request to start from the youngest.
Okay, good afternoon, everyone. My name is Priya Prakash. I am the founder and the CEO of an organization called HealthSetGo. And as Shriya was mentioning about the why for me is a very personal reason. It all started when I was probably 1 or 2 years old. That is when my very generous Indian family that I have, half Punjabi, was feeding me a lot of food at home, as usually loving parents and grandparents do. And since that age, I started successively putting on a lot of weight. And I remember really struggling with not only my weight, but my entire mental and physical health throughout my childhood. And the whole time when I was in school, I was extensively bullied. I was called all kinds of names, and that had a huge impact on my sense of self-worth. And during that time is when I had no help. I had no help from my school, definitely. I had no help from my teachers, from my family, from my friends. If I wanted to reverse the situation, I didn't know how to do that. It took me more than 6 to 7 years to really change my own lifestyle, my own habits. I started eating well, I started exercising, and today, wherever I am, and I'm in a mental and physically, healthy state, I look back and I realize that there are so many girls out there, there's so many women, so many children who are still extremely overweight and obese in India. And this is not just a problem of the mental and physical health of those children. It's more shocking that most of these people will end up developing a chronic disease when they grow older. There's type 2 diabetes, there's cancer. Many close members in my family have been through all these diseases. And when I see that all of them are preventable, and the main way to prevent them is through lifestyle, I couldn't help but do what I do today. I started HealthSetGo with that vision that I want to work with children. I want to make sure that they inculcate healthy habits and healthy lifestyles at a young age. I want to provide access to healthcare to not only people in urban scenarios, but also people in the most disadvantaged societies of India. And today we have touched over 200,000 children, their parents, the communities, and the teachers across the country. So that's my story and why. Next youngest.
How do you define that? Go ahead. Okay. Thank you, organizers, for having me here today. It's amazing. I've been to so many conferences, and we see very little women participation, let alone women entrepreneurs. So thank you so much for having this session in the first place. The reason why I started Weljii is the name of the company. I'm the founder and CEO of that organization. Our focus is helping people form sustainable lifestyle habits. Very close to what Priya is doing, but Priya's focus is more on children. Our focus is more on adults and older population. The reason why I started this organization comes from a very personal journey. I was 16, slightly overweight, wanted to lose weight, And I started getting into exercising and very soon realized my passion for movement. Very quickly became the Reebok fitness brand ambassador in India, where I was teaching about 1,000 classes in a year, did television, and it was an amazing time of my life. I was only 16, 17 years old. Here I was touching so many people's lives. And their quality of life was improving, their health status was improving, their health outcomes was improving. It was a very satisfying, gratifying period of my life. And you know, thereafter, I happened to see somebody doing a headstand in my family. And it came from this curiosity and said, I want to be able to do that. Little did I know that the headstand is a manifestation or understanding that, you know, the pure meaning of headstand is conquering the unknown or conquering death. So my curiosity with the headstand led to my yoga exploration, and that's where I started delving into and expanding the dimension of health that went beyond physical health and went into emotional, mental, and spiritual health. At the ashram, in Shivananda ashram, where I was formally trained, at a very tender age of 22, where most young women were asking their parents to have permission to go to discotheques, I was asking for permission to go to an ashram. I lived at the ashram for a few months, and that's where, you know, I started asking very profound questions for a young woman. I was asking questions like, who am I? What makes me happy? Why was I born? Those are profound questions, and after many, many months of meditating on the riverside, I realized I had to devote my life towards improving lifestyles of people so they could have improved quality of health and well-being. Fast forward 15 years from there, you know, sometimes you have a vision, but you may not have the courage to follow through. You fall in the usual trap. I worked with corporate India, corporate America, sold technology worth millions and millions of dollars, but somewhere, there was a vacuum in my life. And you know, I had 3 car accidents, which left me almost bedridden for a few months. Every flight that I went on was delayed. My bags would go missing. If she was traveling with me, her bags would arrive on time, and my bags won't arrive on time. So the universe was actually sending me a message, hey, there's a misbalance in your life, and you're not really following your dream. I quit everything. I sold everything that I had, moved into a tiny apartment in San Francisco at the age of 34, went back to do my second master's in integrative health. And that was really the key, because thereafter I started working with some really amazing organizations such as Osher Center for Integrative Medicine, Charlotte Maxwell Center for Cancer, Aetna, Gertenstein Institute, where I really saw health of a person is beyond just medication and surgical interventions. It's really about a client-driven, client-centric, holistic approach where we need to look at every aspect of somebody's life, whether that's physical, emotional, social, spiritual health. And it's a balance in all of these dimensions that leads to wellness and well-being and good health. And when there is imbalance, that's when we invite lifestyle diseases. So I created, as a part of my thesis and my master's, I created a model that I wanted to actually implement in India. So I decided to come back to India, and that's how, you know, Weljii came into being. I first started off as a practitioner, and very early on I was picked up by Max Hospital because they said we were looking for a health and wellness coach in a country. We couldn't find one in the last 5 years with the right credentials. Today, Weljii is the recipient of 50 Best Wellness Company Award for innovation for lifestyle disease management and disease prevention by use of behavioral change and habit formation. Today, we are training health and wellness coaches all around the nation. So we are creating an ecosystem of talented health and wellness coaches to address the problem. So on one side, we're training and creating the talent pool. On the other side, we are actually servicing the industry. So today, we are the National Wellness Coach Partner for Max Hospital, Reliance, Aspire, which is the leading concierge service, MQDC, and several others. So it's really, right now, I'm really living my dream. And I can tell you it's not been easy. I think for any of us, I don't think it's an easy journey for where we are today. There's a lot of hard work that's gone behind it, and I'm very happy, and that's the reason why I'm here. Thank you.
Good afternoon, everyone, and thank you, organizers, for having me here. I come from a slightly different background, though, of course, from the healthcare industry, but the pharmaceutical world. So I have read and bred only farmer for the last 3 decades. And while doing so, it's all been about meeting and chasing targets. That's what happens in the pharma world, whether you're on the shop floor, whether you are in the corporate business side, whether you are in R&D, it's just about that. So the point was, I was thinking about starting something of my own for the last few years, and finally it happened about 4 years ago. And I'm the director of this pharmaceutical consulting company called Cadence Hub. The name is a little strange, not many people understand it, but yes, it's all about establishing responsible partnerships and being responsible in this world. While being in the corporate world, in various arenas of the pharmaceutical industry, being a woman was not easy. You had to have, I've had to have had questions to, answers to questions like, when I joined in the production departments, it were things like, what kind of harsh words can you use with the people around there? When I came to head a production unit, a pharmaceutical production unit, there were questions like, are you able to fire people? And in the corporate world, where you are treated as indispensable while you are in the corporate world, while you are in that job, there were things like, okay, when you have your children, you're going to be taking some maternity leave. How are we going to manage for 3 months? And one of my answers was, well, if you hire a guy and he has an accident and he is out for 4 to 6 months, how are you going to handle that? So moving on, after really spending a good long 3 decades in the industry, it was more about, okay, we are in the healthcare sector. The healthcare economy worldwide is numbered at somewhere around 10 trillion, and the pharmaceutical industry there is about 1 trillion, which is about 10% of the global average. If you look at India, again, we have numbers counting to about 330 billion is the healthcare market segment. This is some different reports which will vary here and there. And out of that, 33 billion is the Indian pharma, again about 10%. And how many women do we have overall? While the averages is about, in the healthcare sector, it could be about 28 to 32%. In the pharma world, it's just about 8 to 10%, and various reasons amongst that. So the point was, what is it that we could do? Is it something that women can't do, or it's just that women are scared to do? So the consulting company was established to look at various compliance functions. How is it that pharma can work better with the medical fraternity? Whether the compliance worldwide can be managed in the Indian scenario? And how can the Indian pharma be equivalent to the global pharma scenario? We talk about affordability, yes, that's right. But should affordability come at the cost of quality? So it's bringing this and other kind of awarenesses that Cadence Hub is all about. Thank you very much.
Good evening, everyone. This is Dr. Debleena Bhattacharya. So I want to thank the organizing team and Professor Dr. V.K. Singh for giving this platform to 7 wonderful ladies, 6 wonderful ladies, 1 more. So I started my journey, I am more from environmental field, biotech initially, then environmental. So this journey started, I was doing my PhD. During my PhD, I told my guide that I wanted to work on, everyone, from the morning itself, everyone was talking about hospital. No one is talking about the waste that hospital is generating, or the healthcare, or the pharmaceutical, pardon me. So we are more concerned about the healthcare, the unmet needs that we need to focus on. That will be on the wastewater that is generated, the solid waste that is generated by the healthcare system. So I told my guide about this. He said, why hospitals? What made you think about hospitals? I'm comfortable with, if you go for chromium removal, that will be fine for me. That will be easier. Coal mines were easier. I did my PhD from ISM, that is IIT now. So they have the coal mines, and it is better if you go for chromium removal and all this thing, wastewater. So I said, no, I wanted to work on pharmaceutical wastewater. Today's world, we are not focusing on the glass that we are having in front of us. In the era of half empty and half full, we just need to focus on the amount of water that will quench our thirst, not the more, not the less. So I told my guy that I wanted to go for this wastewater engineering. He said, okay, go ahead. I am not into it. You have to do it on your own. So I accept that offer. I will do it, I will finish, and I will submit it. So from that day till now, after my PhD is complete, after my PhD is submitted, people get to aware that, okay, antibiotic residuals is a problem, and that will lead to AMR in the future generations. And in this, after one PhD, several PhD came up with this topic. So that was an unmet need in a small particular area, and now it is a global problem, as we can see. Thank you.
Thank you, Dr. V.K. Singh. You are running this InnoHEALTH. I am again your innovation, because you are my first teacher when I was doing my CISSR course. You taught me that time. So actually I am very much inspired by a Hindi song. कोमल है कमज़ोर नहीं तू शक्ति का नाम ही नारी है जग को जीवन देने वाली मौत भी तुझसे हारी है. So that is why I always feel, if I will tell my story like others was narrating, then everybody will say, Pagli rulayegi kya? So I will not go into emotional story, because my story is actually, my struggle was very, very different from others. But anyhow, when I got this chance, we are running a hospital, chain of hospitals, but when I got this chance to run a unit by myself, that was the time I thought, and my hospital name is Yashoda. Yashoda is the name of my mother-in-law. So it's, my whole life is very emotional, so it is also a very emotional story that I am running a hospital which is by the name of my mother-in-law. So I thought I should prove myself, because I am a non-medico. So when I joined my hospital 19 years back, everybody was thinking what she can do. She's supposed to look after a few things like HR and something. She won't be able to run any, medical legal things or medical things or anything which is very technically sound things. What she will do? Everybody was, I can see that question in everybody's eyes. So anyhow, I thought I should prove myself. So today I am sitting here, and two of my seniors, Dr. Vijay Agarwal, Dr. V.K. Singh, who has seen my journey and who are my mentor and who really encouraged me to do some good work. By the grace of God, my hospital is doing so many good things, like she was talking about hospital generated waste. So my hospital is Green Clean Hospital. Green Clean means we are trying to eliminate all the waste and all things which can harm environment. My hospital is 4th in India and 1st in UP. We are doing so many things which others are not doing. I am not claiming myself that we are the best. Nobody is best or nobody is perfect in this world. But just to take an initiative that we should do something for society. My hospital is a center for pharmacovigilance of India. So we are looking for adverse drug monitoring events. And we are giving data to Pharmacovigilance of India. They are monitoring and they are, eliminating drugs. My pharma friend can understand how important work we are doing. So these are small initiatives, and my dream is, generally and luckily, I never find this thing like discrimination between male and female, because in healthcare, lots of females are working, but if you see, only 13% are able to reach the top. Mid managers, lots of people you will find, but on top, only 13% females can reach. But recently, I am actually joined so many things in so many chambers and here and there. That time, I really realized that healthcare is different from other industries. We actually help females. Recently, I joined somewhere. So I found that people are not actually helping females. They are not happy with that. How a female can go become their boss. There was a, even not only in their eyes, in their words also. Oh, why madam will go for the election or madam will fight this election. I don't think she will be able to manage this big industry, this and that. So I realized there is a glass ceiling still. But I am thankful to healthcare industry that they really encourage me, they help me, and I am here. Thank you so much.
Thank you. Hello. Thank you. I think what came across very strongly in that conversation was that everybody's personal stories led to where they are today, and there was the personal circumstance or a personal event that really made them realize that this is, your calling in life. It's interesting that two of your stories and two of your startups are really focused in the space of behavioral change. So Priya, I would love to understand a little bit more from you about how you're actually driving this behavioral change and how you're thinking about preventive healthcare. We talk a lot, and a lot of the hospitals are talking about communicable diseases, but how are you trying, especially in children, to focus on preventive healthcare?
Thanks, Shriya. So, as you said initially, there is one doctor for every 11,000 people in India right now, and that ratio itself speaks a lot of volumes about why preventive healthcare is needed. So right now, if the solution for us, for every person who has cancer, diabetes, heart disease, is for them to have medication or to take them to a hospital, that is not a sustainable solution. I think today, even with the population growing at a very fast rate, the rate at which people are getting these non-communicable diseases is also growing at an equally fast rate. And we just do not have enough doctors, hospitals, and care centers to take care of them. Which is why with HealthSetGo, what we're doing now is working at the grassroots level, starting from children. We actually start our program at the age of 2. And believe me, when I started doing a simple annual medical checkup at every school that we work with, and today we work with hundreds of schools, we started with doing a simple annual medical checkup, and we never thought that for children. Initially, I thought, what is wrong with children? I think that is the biggest, one of the misconceptions that we have today, that in the whole child life, we can just leave the children to do whatever they want to do because they are just children, and then whenever something happens, you go to the doctor. When we started putting a preventive checkup for kids, which was something quite unique even in schools, that's when we started realizing, wow, there is a lot of issue that's happening right at that level. We started detecting various ailments. We started detecting high rates of obesity. In the rural children, we started detecting anemia. We started detecting malnourishment. And we realized if this is not stopped at this stage, definitely the kind of hypertension that children are developing, PCOD, thyroid, hormonal disbalances, all of that is starting at such a tender age. If we do not stop it there, tomorrow the amount of patients that are going inside hospitals is completely unsustainable for the entire country. And that is why the preventive healthcare angle, Shriya, is what I believe is extremely important and where most of the investment and financing needs to be going versus creating new hospitals. I mean, nothing against hospitals. There are enough people who need our care and our attention and our doctors. But the amount of people we can prevent from ever entering a hospital and just creating a habit of taking care of themselves, that potential is so massive, especially with children. If we know what we're eating today, if we know how to take care of our own body, there is a giant economic saving that the country can have. And if you calculate the social return on investment, what you call for every dollar that is spent on preventive healthcare versus how much you will save, I mean, that's a huge impact on the economy. So I would really urge, all hospitals, even today on the panel, and all healthcare providers to start focusing on prevention. Go to our children, go to schools, try to detect diseases at a very, very early stage and create habit transformation so that when those children grow up, we can create a much healthier planet for all of us and save a lot of money for our country as well.
Thanks, Priya. I think that's a beautiful message for everyone. But what about all the people that didn't get the message when they were kids, right? There are all of these people that missed getting the message and are now in these terrible habits.
program addresses that? Thanks so much for what you said, and it's amazing that you and I are in the same space. You're working with children and I'm working with adults. You know, India, per se, we have such great control over infectious diseases, right? We've managed to have control over that. We have vaccination, we have treatment and everything. It's the non-communicable diseases which are a challenge today in the country. And these are all stemming out of our habits. And these are habits that we have cultivated in the last 5, 10, 15 years of our life. And we can actually change that by taking accountability and having an increased level of awareness, and therefore change the entire health ecosystem of the country. So on one hand, we've controlled infectious diseases, we've increased longevity, but have we really improved the quality of life? We have not, right? Look at the higher incidence of lifestyle diseases. India is by far the world's diabetes capital, and cardiovascular diseases, depression, stress. All of these have become realities of our life. And so when a patient comes to me at Max Hospital, they say, "Hey, to hamari life hai." And it is sad that people say that. Now, the bigger question is, I think in the next 5 to 10 years, the healthcare industry is going to see a paradigm shift from what we've been talking about since morning, from a client-centric, client-driven model. And the new healthcare pyramid is going to look like this. The top section of the pyramid, the 5% are people who are going to need surgical intervention, need hospitalization, right? That's only 5% of our population. The next 25% of our population are people who need a clinician or a doctor's intervention, right? The balance, 70 to 75% of population is coming from lifestyle. And that's where health coaches and wellness coaches come into the play, because they can really help people form sustainable habit formation with a 360-degree perspective. And that's exactly what Weljii is doing. You know, when I came back to India 5 years ago, there wasn't even a single health and wellness coach. And now you guys know what a health and wellness coach is, and I'm sitting on a panel. So 5 years ago when I came, you know, how do I even work on my model, because there are no health and wellness coaches. So the first thing I actually did was to create an institute which trains health and wellness coaches. So started creating the talent pool. Yeah? Because as a single health coach or a wellness coach in the country, I can't really address this big epidemic. So started off with a training program, certification program, which are global standards, international standards. So we have trained. It's interesting that in India, 35% to 40% of our people who are doing certifications with us are doctors. The reason why that is because doctors are beginning to realize that the consumer or the patient is asking for something more. They want to address their problems. They want to take, action. They are more aware. They're more educated, but they need a little more hand-holding. So the 75% of the pyramid is talking about lifestyle interventions. So we first trained health and wellness coaches. The second thing that we're now doing since last year is actually servicing the industry, right? So we are now working with some leading organizations, as I mentioned. What we're really doing is navigating people from sickness towards wellness, right? What happens in a particular continuum is, first you see signs of disease, then you see symptoms of disease, then there's, early onset of lifestyle diseases, then there is death, right? What we're doing is we're trying to bring them back to the neutral point and move them towards wellness with increased amount of awareness, increased education, and high degree of personalization. Because there might be 10 people who may have diabetes, right? But the underlying root cause for that person is going to be completely different. Even if the underlying root cause of the problem is same for that 10 people, the approach has to be different because it has to be completely customized to that person's lifestyle, their choices, their strengths, their abilities. So this whole behavioral science that we're talking about is really stemming from neuroscience. You know, the brain has millions and millions of neurons that function with each other. So we are now changing the neural pathway in terms of how people think. And a lot of diseases actually stem out from the mind. You know, everything kind of starts from here, the manifestation starts from here. So we're really focusing on that. Today, I think in India, we've partnered partnered with Max Hospital, and I'm very grateful to them because this is the first hospital in the country today that is just not looking at prevention from diagnostic tests. Because diagnostic tests only gives you a health report card, doesn't really doesn't really help you make changes in your life. So today at Max Hospital, everybody who goes through a preventive health checkup has to see a health and wellness coach. And 17 different programs around weight loss, get fit, get active, diabetes management, hypertension management, stress management, depression relief, revitalize your relationship, healthy aging. These are all programs that are rolled out at Max Hospital, Reliance, Aspire, and now we've rolled out these programs at TCS, in corporate organizations, Wipro, Philip Morris, and many other corporate organizations. And what we've seen in a typical session is people who come through a session have several aha moments. Today in the morning we talked about compassion, empathy, and listening. In a typical session between a doctor and a patient, the doctor, how much time do you think a doctor talks and a patient talks? Okay? The patient gets to talk about 30 seconds, where an entire conversation is stayed by the doctor. So I think we need to flip, we need to hear more, we need to have more compassion and empathy, and that's what we're really, really doing. And our vision is to really impact as many lives as possible with improved quality of health outcomes and overall health and well-being.
Thank you, Preeti. That's, I think, very interesting. I'd love to bring Upasana actually here because you're running, a hospital chain to see that, are you also looking at healthcare from a similar perspective?
Actually, she is right. Everything comes from mind. So that is why if somebody will visit my hospital, they will find a difference from other hospital to my hospital. Whole time there is Om chanting. So when somebody is sitting or waiting for patient, doctor or ICU patients to relatives, they are listening that chanting, and it gives really a pleasure. And I wrote a paper and it was accepted in international conference that Om has a healing power. So actually prevention is better than cure. It is really required. We are also focusing on preventive health. Same time, there is one thing which is these days everybody is talking about artificial intelligence and the corporate sector and private equity, but I think whatever it is, there is a relationship between doctor and a patient. That touch is really required. If your doctor is, keeping his hand on your head and saying, everything is fine, don't worry, I am here to look after you. This, at least for me, if my doctor, I am even talking on phone and I am asking him, I am not feeling well, and he is talking to me, no madam, don't worry, I am actually feeling relieved and I am getting relaxed and I am feeling better. This is a thing which no artificial intelligence can do. And in my hospital, because I am a decision maker, so there's a need of, hospital needs some sympathy, some empathy. Sometimes there are poor patients who really need healthcare, but they don't have money. So that time, as a healthcare provider, we are supposed to give them free of cost treatment. Sometimes there are very, very, emotionally burst relatives are there. That time they need some shoulder. We are there to help them. Don't worry, everything will be fine. These small words can make a difference in anybody's life. People who are sitting here, they must have some experience in their life when they were not well or their loved one was not well. So that time your experience with the healthcare, that really makes a difference in whole industry, whole society. So we are also doing some different things which is different from day-to-day routine. But I really appreciate my previous speaker. She has actually took a different initiative to do healthcare in a better place for others.
Thank you, Pastor. Veena, I was very inspired when you were talking about the difficulties you faced. And it was almost like, you have to be masculine to survive in this industry. And then if you don't kind of emulate a man, it's, you have no place here. So, you talked a little bit about it, but I think for all the women here trying to be in healthcare, it would be very interesting to hear your perspective on how you managed that journey, as well as, why you actually feel there aren't enough women in this space.
Thanks, Shriya. Well, you have to emulate a man, but with your compassion, which has to be ever-standing. You have to be capable, as our keynote speaker said. And besides that, there are certain privileges for women, I don't think, which need to be exercised really. Only if the need be, you need to do that. But if any woman wants to stand shoulder to a man, I think you can't have excuses like, I need to rush back home, I can't work after 6 o'clock, I can't do round-the-clock work. For whatever reasons, I am allowed to be out only such and such time. And I think that's also one of the reasons why the percentage of women in some of the work areas, like the pharma industry for that matter, they are pretty low. They are minuscule, I would say. People don't want to travel because they don't want to leave the home behind. But how do you want to be treated at par with men if you're not ready to do that? You have to let go of something to gain something. Either you don't complain, and if you do, then don't look for such things. So what's happened, at least in our industry, is that typical corporate 9 to 6 jobs would be regulatory, product development, pharmacovigilance, quality analysis, being in a quality lab, and that's about it. When you want to get into marketing, when you want to get onto the shop floor, those things are a complete no-no. So a big sector just moves out. So I think for the women, it's important to take up the challenge and be with it, and then bring in a woman's perspective into it to do the job much better, which they are known for. In fact, there's like 5, 6 lines of a poem which I read, and I think I've practiced that, I've followed that, and maybe there are more women who can look at it. It was something that just retained in my mind for maybe 2 years. It said, you are creative like no one else. You are intelligent like no one else. You like to learn, you like to share. And you are being absolutely fair. Your hidden tears make you strong. Your patience takes you through every storm. Hey woman, your compassion is a class apart. Never lose your heart and never fall apart. So, in fact, on many occasions, and it has happened with me also, I mean, not that I have done it, but one of my colleagues, women feel that shedding tears is a sign, I mean, to get some pity for themselves, but they possibly don't realize that it's a big weakness which comes up in the corporate world for them. So, while it may happen at sometimes, why do you want to bring it out in you? Why do you want to tell the world that you are the weaker one? You are not. You are the strongest of all. Thank you.
Thank you, Veena. That's very inspiring and lovely to hear. But I do want to say that, sometimes women don't have the support system, that you can leave your family behind, and you might not have the support at home in your children, or, a spouse maybe that's willing to look after it. So, Debleena, maybe, I know you work with rural women, and it might be interesting to understand how entrepreneurship at a rural level with women, where maybe they don't have that support system, how do they, think about addressing some of the things that Veena talked about?
Thank you, Shriya. So earlier I was working with Shriya, an NGO. They were more concerned about the rural women. So the rural women were in Gujarat, you get to see the rural entrepreneurs. The women are the local entrepreneurs. They can make out kepla, khakra and all this thing to survive, to make out their own money. They are the entrepreneurship starts from the home itself. So these rural women, what they did, for the nutrition of the child, they didn't have this complan bone wheat and all this thing. So they bought this weeds, the weeds that we throw from the agricultural fields. That
wheat has lots of nutritional values, and that wheat they are using as a food supplement for the children. Nobody has told them this thing. Nobody has just given them the knowledge. They have culminated this knowledge of their own. They have made this impact in their children's life on their own. And now the children are pretty much nutritious than any urban children. So that's the change they brought. That's what I found. And entrepreneurship in this rural area needs to be uplifted a lot more, because urban women do have lots of facilities that they don't have. They have the facilities of, you have the sanitation and all these facilities in urban area. You don't have that type of facilities in rural areas. They have designed all these parameters for waste disposal, and they are using actually the waste that is generated from cutting the vegetables. They have made it used as a cleaning agent for their homes. So these type of innovative thoughts that I have seen in them is really inspiring. Thank you.
That's lovely, and I think that brings us back to the topic of innovation and innovation in healthcare, which was really the theme of this conference. And innovation, like you said, didn't come from anywhere. And I think, Preeti, Priya talking about innovation as well, which is a different mindset, and it's innovation of the mind. Here you're talking about using, if you don't have access to facilities or, heavy medication, why can't you use natural substances for that? So I think that's lovely. I was wondering if we could, since the topic of the day has been unmet needs in healthcare, if everybody, maybe we could just go around the table and say, what do you think today is one of the top unmet needs in healthcare, and what are we doing to address it in your own space?
Lack of workforce, that is the most important thing in healthcare. Lots of people who are really need medical care, but even our government is really looking for the Ayushman Bharat and other, so many other schemes. But who will look after? Less doctors, less nurses, less technical staff, paramedical staff. So we actually, unmet need is more than workforce is really less. So we are supposed to create more medical, paramedical staff, more medical staff. So until unless there will be not sufficient medical professional, it is actually very tough to give, even if I talk about UP, I think 20 lakhs beds are more required. So many things which we really want, more beds, more doctors, more everything. Ye dil mange more, ye healthcare mange more. So we really want everything more, only then we can meet the needs of the era.
For me, more STPs should be installed in the hospital and the pharmaceutical industries, because we think about the medicines, we never think about the wastewater and the waste that is generated. I can give you one example. There was this guy, he came up with the idea that why not use the aluminum foil, that is the medical strip that is being thrown away, and generate energy from that. So that's the thing we will do it in future, I think. Microwave fuel cells is the upcoming things in the wastewater field. I think most of you might be knowing about it. So that amount of energy can actually run a whole STP, sewage treatment plant. That power it has. Thank you.
Thank you. I think I've spoken quite a lot about what Weljii does in terms of addressing the unmet needs of the healthcare. My request from the industry and the policymakers is, as a nation, when we look at or we define what success is, we're looking at, we think, okay, how much money does that person have? What material possessions does that person have? What is their professional status or the title they carry along with their name? I think we need to kind of change our prism. We need to look at how healthy and how happy we are. And we as a nation need to incentivize individuals and society for staying healthier, staying fit for a longer period of time. So my request for policymakers is to kind of look at this from a different prism. And also when I look at insurance companies, right, we have huge policies that only covers sickness, right? It doesn't really cover wellness. So why is that? I think there needs to be an intervention there. I think insurance plans should cover gyms, should cover spas, should cover nutritionists, fitness trainers, health and wellness coaches, so that more people, the middle class, the lower middle class population can also avail these services rather than this service being only accessible to the niche population. I think one of the questions that a media person had asked me, Preeti, how are you going to make it accessible to all? I think once insurance companies change their mindset and cover all of these things, I think more people will be able to avail that and take advantage of that. So that's my request to the industry.
Completely agree with that. I think even if a basic health checkup can be included every year, I'm sure we'll be able to reach lakhs and millions of students as well as adults within that framework. But I mean, of course, I've touched upon preventive healthcare not being the focal area as the unmet need. But I also just wanted to touch upon technology in healthcare. And I wanted to talk about how much of the healthcare practices today and our public health programs as well as our hospitals run on paper and on registers. And I think that, organizations probably like the one I'm running and there are various other social enterprises, we're all focusing on how we can put technology into the core of screening, into the core of medical operations, into the continuum of care, so that if I screen, let's say, one child somewhere with a disease, that information is available to the right stakeholders at the right time. And the data movement needs to start in healthcare from a very tech point of view. And I think if we can encourage the use of technology in our government programs, in our public health programs, that will really, really make sure that we are taking the right steps at the right time. And every decision maker, government, policy maker is aware of what is the health status at any given point of time in our country. I think that should be definitely encouraged. And one unmet need could be that we bring in a technological revolution into healthcare as well.
Okay. Since the morning, we've talked about high economy countries, India being a low economy one. The patient to doctor ratio requirement is 10 times more what we have in India. The time that a patient spends with a doctor is hardly about 2 minutes, in which the patient speaks 30 seconds and the doctor speaks maybe another 30 seconds, and it's less than 2 minutes, includes the time of going in and coming out. So how is it that it's addressed in some parts of the high economy countries? What I have seen and what I know is that that's where the clinical pharmacist works together with the doctor and takes out a lot of responsibility from the doctor in terms of spending time with the doctor and addressing some of the needs. If you've been to some of these dispensaries, the so-called primary healthcare centers which are there, half the time you see the patients coming back to the doctor for nothing else but just kind of asking, do they have the right medication in hand? Is it something that has been prescribed? Because in the Indian scenario where we have the market, the pharmaceutical market, which is totally the branded generic market, the products that a doctor would prescribe mostly would be available in the hospital where he is or around in that area. And if the patient wants to go back home and buy a particular brand, there are chances that it will not be available. Now, in the high economy countries, again, there is this pressure on writing generic products. It's the same in India, which is not really being complied to as of now. We are still waiting for it to happen. And these questions have also come in from certain high economy countries as to are the brands, are the generics as good as brands? Is it really a fact that they are as good, or it's just the healthcare budget that is being brought down by these countries and the generics have to be prescribed? So again, if we go back to the same part of the pharma industry, the situation is different in different countries. The situation is different in India, in the developing economies. The situation is different in the well-developed countries. There is a focus in India on prescribing of generics. There's a question of affordability, but who's monitoring the quality? Is it a matter of concern to all of us, or it's really not? Another unmet need comes into in the medical fraternity, where besides what the clinicians are doing, they prescribe a product, and that is about it. So we did some small research to see how much of the pharmaceutical world are the clinicians actually aware of. And we realized it's not really the case, because they do know the brands, maybe the generics, but that's about it. Not really how, what companies, what is being offered to them, because yes, there is a label, it's approved by the CDSCO, by the drug manufacturer, so it's available onto the market. So we've started this experiment in Australia and UAE through Cadence Hub, which is, so there's an online course on brand versus generics and how they are comparable and where they are comparable. And it has been put up by the institute called IMAC, which is Australian Institute of Medical Administration and Compliance. And this actually also gives credit rating points to the doctors if they go through that course. So that's another need that can be, another possibility that can be used in India, in our country, to serve the nation better, to serve the patients better.
Thank you, Veena. I think that's amazing that we have such a diversity of options available, and I think that's credit to the panel and to the organizers to putting such a diverse panel together that could talk about so many different things. I think we've had an engaging conversation. I don't know if we have time for any audience questions. I think we're running a little bit. Yeah, maybe just 2 or 3 questions if anybody has questions for the audience. So for the panelists from the audience. Okay, so I don't see any hands. Great. So if you could just introduce yourself really briefly and say if there's a specific person you would like to question.
Sure. My name is Saurabh. I run a company called Plum. We are taking care of employee healthcare. This is to Priya. Priya, you talked about you're primarily, when you go with HealthSetGo to the children, the first point of contact is through a health diagnostics. Could you elaborate on what kind of costs you see on the health diagnostics and what kind of health diagnostics these are, the vitals, etc.?
Yes, so thank you for your question. So when it comes to children, we usually typically do not go with any blood diagnostics at the first level. We first try to look at a few different parameters. So one is an entire physical examination by a team of general physicians. Then we have a dental examination, we have an eye examination, and then we take some vitals. So we take the height, weight, BMI, BP, and pulse. So these are the vitals that we do. And apart from that, in the physical examination, we cover ENT as well. So when you talk about a physical examination, it's a head-to-toe examination. So in case there's any issues that the child has, even when it comes to skin-related issues, whether they have abdomen, there is some kind of an issue there. There are various issues that can come out. In fact, we can even detect signs and symptoms of some various vitamin deficiencies. Now, after we've detected these things at a screening level, that is where we then take the next step to say that now you need to go and get blood diagnostics, because we cannot have every single child also pricked at the school. There are some, we have some restrictions when it comes to those things. But even through a screening level, the kind of things that we're able to detect and diagnose are quite broad. There are quite a few conditions which come to light. Neither parents knew about them, neither did the school know about them. We have medical checkups going on even today in schools across the country, and every day we send a list of children to the school in simple things, for example, that they need to get their spectacles changed or they cannot see the blackboard. These are things that directly affect their quality of life and quality of education. So we start with that, then we make sure we track the next step that happens with each and every parent in the school. Have they taken their child to a dentist? Have they got a new pair of spectacles for their child? Have they started, supplementing the children with some kind of vitamins or taking care of their nutrition? So that's where we start from. And because there is no blood diagnostic involved, the cost is extremely low initially. So there's a very low barrier to entry for us. We are able to give it at a point and at a price which is extremely affordable. We don't want any of this to be expensive. We wanted to reach out to right from government schools all the way up to the best schools of India. And right now we cater to the entire range of schools. So that's how we've kept the cost extremely low, and it's very, very affordable to the masses.
Do we have any other questions? Yeah, I know. We answered everything already in the panel. Great. I would love to, thank you everybody. I think that we learned a lot about different challenges in health and also about challenges for being women entrepreneurs in this space. So I would ask everybody to give a big round of applause to them.
Thank you, ladies. Very interesting and very intriguing session indeed. I would like Shriya to please do the honors of presenting mementos to our esteemed speakers.
Oh my God.
आगे से लो अच्छा That's it. I'll give it.